Ladies and gentlemen, hello, and thank you very much for waiting for a long time. We would now like to start Nikkei Forum, Investing in Japanese Regenerative Medicine. Thank you very much for joining, despite your very busy schedule. I will be serving as a moderator for today. My name is Yukimi Yamada. BS Television Tokyo Morning News program, Nikkei Morning plus ST, is the one that I serve as a moderator in the morning. I hope you will be with us until the end. Today's lecture will be given in Japanese and English. Simultaneous interpretation receivers have been handed out at the registration desk. If you have not received one, please ask a staff member near you. Channel 1 is Japanese. Channel 2 is English. Please refrain from eating and drinking in the hall. I ask for your understanding. Now, Honorable Dr. Takemi was scheduled to give a lecture at 1 p.m., but due to his sudden official duties, he will speak later today. Therefore, Dr. Nakamura's lecture, which was scheduled for 1:20 p.m., will be moved up. Now, Professor NORIMASA Nakamura, the Institute for Medical Science in Sports at the Osaka Health Science University, will give a keynote speech on clinical application of regenerative therapy to joint disease. International perspective. Dr. Nakamura, the floor is yours.
Hello, everyone. My name is Nakamura. Today, I would like to talk about articular disease, particularly OA, osteoarthritis, the damages to the cartilage, which is believed to be the cause of the articular diseases, and also the clinical application, and also the development status in Japan. And thank you very much for giving me this opportunity to make presentation. I'd like to appreciate deeply from my heart. In human beings, there are articulate joints, and there are over 260 joints in our body. At various places of the body, they are playing a very important role for moving and important tissue. And on the surface of this bone, forming the joint, and this is the cartilage in between the bones. And the characteristics of this includes the load distribution, shock absorption, and lubrication of the joints are the functions of the articular cartilage. But as you can see here, there is no blood vessels. Therefore, due to a lack of blood circulation, the tissues without the blood vessels are not able to repair itself. Therefore, there are various issues caused by this lack of blood circulation and poor ability to repair. Once the cartilage is damaged, the area will expand over time and become deeper and deeper, and in causing pains. And below the cartilage, there are bones like this. And once the damage is spread into the bone beneath the cartilage, and putting the patient at risk of developing osteoarthritis, causing the deformation of the bone. So once the damages are caused to the cartilage, and treatment needs to be done in order to prevent the development of the OA, osteoarthritis. Osteoarthritis, according to the CDO, the United States, in 2040, it is expected to affect as many as 80 million people due to osteoarthritis. In terms of 1/3 of the population resides in Japan, so over 20 million people in Japan will be affected by osteoarthritis. So about 20% of the population may be affected by osteoarthritis even in Japan. In a best-selling book by Linda Gratton et al., and it is pointed out that the current generation in Japan under 50 years old is likely to live more than 100 years. So it is good to have longer life expectancy. However, the life expectancy is growing. However, the healthy life expectancy with which people are able to live their lives without worries. And then the problem is the difference between these two expectancies. According to data from Japan's Ministry of Health, Labor and Welfare, this gap is 8 years for men and 12 years for women. So even if they are able to live longer life, but they are not able to be active. So in terms of QOL, this causes a very serious problem. So we needed to have people live healthily through one's whole lifespan. And this is the mission for us. So what are the diseases which are shortening the health span? Dementia comes number one. And actually, the musculoskeletal, the OA, comes, and also fracture comes to the top ranking positions. And the fractures caused by the osteoarthritis as well. So inclusive of that, osteoarthritis is affecting and shortening the healthy life expectancy significantly. Therefore, it is very important to suppress this disease. So osteoarthritis, once neglected or not attended, the bone will be destroyed, and the deformity will be caused, and then reaching the end stage of this disease. And then artificial joints by cutting the end of the bones, and then the artificial implant needs to be made. Without doing this kind of a treatment, there will be no other effective options to treat it. However, with artificial joints, the knee will lose the ability to bend deeply, affecting the functionalities of the knees, making activities such as reading a line on the green when golfing or kneeling on the floor in the formal Seiza position difficult, and exercise may become difficult, so causing inconvenience to patient's life. Therefore, in this sense, reaching the end stage of the osteoarthritis, and even before treating with the artificial joint implantation, you need to try to treat this disease, save the joint in our academic society, and I believe that this is very important to save the joint or conserve the joint. So what is important is the trigger for development of the OA, the refractory damages caused to the cartilage, how we can treat it. Only with the own bodies, because of the lack of blood vessels, it is difficult to cure. Therefore, biologically treat this damaged area. That is very important. And now, biologically repairing the lesion, the cartilage in the body, and there is the cell-based therapy gaining attention. So in the cell therapies, first autologous chondrocytes are taken from the patient's body and then cultivate and expand in order to implant them. So that is the beginning of the cell-based therapy for osteoarthritis. This autologous chondrocyte implantation, ACI, over 30 years ago was first reported. And after that, there has been the reports of more than thousands of cases to date utilizing this ACI. I'm sorry, this is harder to read. But currently, there has been several improvements made, and under the random controlled trial, the control group is a microfracture, and the damaged cartilage is curated, and also the holes are made in the bones, and then from the bone marrow, the cells are derived and induced in order to repair the damaged area. And 2-year results shows that it has been shown, the efficacious results has been shown with a significance. And what about the quality of the repaired tissue and microfracture, which was developed over 60 years ago, and the quality of the repaired tissue is the same as that of the microfracture method, which was developed over 60 years ago. And also, we can develop a new treatment. It will be able to maintain the repaired tissue at a better quality for a longer time, and it is expected to establish treatment that regenerates cartilage more effectively. And in Japan, the Regenerative Medicine Promoting Act was enacted in 2013, which allows the implementation of cell therapy using cultured cells more widely, and cell therapy research using stem cells has been widely conducted, utilizing the clinical treatment. So there are various cell types which are utilized based upon the stem cell therapy has become the reality in the clinical setting. And the stem cells used in these treatments can be categorized into two areas. One is the MSC, mesenchymal stem cells, or adult stem cells, which are grown and used from stem cells in the body, which are available in the human bodies, and these are expanded and used for treatment. Another is the embryonic stem cells and iPS cells, which have the potency to infinitely proliferate and differentiate into any tissue. So these are the main categories. Of course, iPS cells are used for treatment, and this is recognized as the ultimate stem cells, and therefore their research is expected to develop, and there has been a lot of remarkable advancement. And on the other hand, mesenchymal stem cells show very interesting facts. MSCs, bone marrow-derived MSCs, transplanted into the cartilage injury, and a year later, and a DNA analyzed in the repaired tissue, and the DNAs of the transplanted cells are not remaining at all. So far, the stem cell treatment, the cells are developed in the tissue by repairing the damaged cells. That's what we thought. However, the mesenchymal stem cells, after being implanted, to some extent will start to disappear. So what were the functions of those implanted MSCs? Actually, mesenchymal stem cells were advocated by Case Western Reserve University Professor Arnold Kaplan, and in recent years he himself said that they recently proposed that the MSCs are not the mesenchymal stem cell, but rather it should be regarded as medical signaling cells, injury-specific drug store. So in order to repair the tissues, various signals are sent, and then for the matrix or the human bodies to promote the repair. So MSCs are considered to be a kind of a drug therapy. So now this treatment has shifted into this paradigm. With that in mind, and then DNA analysis of the tissues, as I mentioned, based upon the result, the allogenic cells can be transplanted, and the cells will not remain for a long time, and to some extent they started to disappear after a certain period of time. Therefore, we don't have to care about the rejection when it comes to the MSC treatment. So utilizing these MSCs for cartilage regeneration therapy, from a global perspective, we can say that Japan has been leading the development. And this was triggered by this Dr. Wakitani, who we can see in this picture, as I said earlier, under the supervision of Dr. Kaplan. Bone marrow-derived MSCs were used in his research in order to provide a treatment for the cartilage, which was reported over 30 years ago. And continue on that, and when it comes to the clinical application, there have been various reports on the researches. This is done by Dr. Ochi, currently the president of Hiroshima University, has aimed for clinical application of a therapy in which iron is incorporated into the cells and a magnetic field is applied, and to cause the cells to accumulate selectively at the specific tissue which has been damaged. And he is trying to apply this in the clinical setting using the same autologous bone marrow MSCs. And this is the tissue utilizing the magnetic field accumulated cells without having the magnetic field, and compared to that, and then overall the tissue seems to be well established, and then integration with the surrounding tissue is being repaired. And this has been demonstrated by his research, and therefore this is very promising, which is aimed at being developed for the clinical application. And on the other hand, Dr. Sekiya of Tokyo Medical and Dental University has shown that autologous synovium-derived MSCs have the superior capacity for chondrogenesis. then MSCs derived from other tissues based upon the capability to differentiate into any types of tissues by expanding the synovial-derived MSCs and then and perform treatment by adding cell suspension to the damaged area of cartilage under arthroscopy and then showing that the cartilage has been repaired. And this kind of clinical research is being promoted.
Now at the Mayo Clinic in the US, Dr. Saris, in addition to the autologous bone marrow MSC, the cartilage tissue around the scar is treated with an enzyme and then mixed up with MSSC and then injected. In order to get the FDA approval, the research is underway. So there are various things about our group. So synovial cells, by using the unique method, if you culture them, a thick tissue like this was created by us. We succeeded in this. TEC, tissue engineering construct, is the name of this. With this, we have conducted treatment research. So porcine cartilage injury experiment is done. So unless you treat the damaged area, you see the exposure of bone. And this red area is the cartilage, but with the TCE, adjacent cartilage, and this part is adhesed, and the cartilage tissue can be repaired. But when it comes to osteoarthritis OA, the bone underneath also have some damage. So in order to treat OA sufficiently, both bone and the cartilage need to be treated as a combined entity. So by using artificial bone, and TSE hybrid material was used, and the treatment is provided. So in big animal experiment, we have reached the stage that we confirmed our efficacy. Dr. Tsumaki of Osaka University, from iPS cells, the particle of cartilage was created. He succeeded in this. So mature cartilage, a good tissue was created. And when you look at the cartilage tissue, if you implant, they are spilled. But with our TEC, to the bone defect, we implanted this material. This is a rat model. Bone and cartilage was carved, and then composite or complex was implanted. This is untreated. Subchondral part is damaged. Even after 6 months, there is no repair. However, if you put this composite in 6 months, very cleanly, it has protruded the subchondral bone and then repaired. And as for subchondral, this is a normal subchondral and untreated one with a fibrous tissue. There is a repair. But if you look at the brown collagen 2, this is a marker for the cartilage. With this tissue, you are able to repair. That's what we found out, meaning that if you blend the two materials and treat it, then without using biomaterial, bone cartilage can be repaired or cured. And this is another area that we need to proceed with research moving forward. Now TEC, it has a potent ability to cure a cartilage. So at the Osaka University, clinical research was conducted. First, from MHLW, the patient's tissue was recommended to be used. So autologous cells were used first in 5 cases of clinical research. So this is the result for 2 years. This is all 5 cases. There are some variability, but you see the V-shaped recovery in clinical score, pain, lifestyle levels, sports activities. Those QOL was measured. So they are called activity level, meaning that the daily activity levels are measured. So in these items, we were able to show a V-shaped recovery. This is a repaired cartilage after 1 year. The smooth cartilage tissue was repaired with the peripheral tissues. So if you look at the middle part, and if you have a biopsy with needle, then tissue was shown in these 5 cases. This is all cases. There are some differences among these, but there is a saffronin dye. With that, it dyes red. What it means is an indicator that the cartilage tissue was formed, so we were able to confirm that there was a repair by shown in this red. So far, first 5 cases, we were instructed to use autologous tissues of patients. That's how we started the clinical research. But this TEC construct, if we are able to create this with the allo tissue cells, then first you don't need to undergo surgery just to get the tissue. If you want to use autologous tissue, you need to do this, but that will no longer be required, so you can reduce the time. So ready-made treatment can be provided to patients instead of auto-made. So if it's allogenic cells or other people's cells, after proliferation, you can store in the cell banks. So it is easy to engage in quality control of them. And as I mentioned earlier, even though it's autologous cells, you don't have to think about the immune rejection response. So there are a lot of advantages in this MSC. So after adding preclinical study results, as mentioned, microfracture was used as a control or comparator, and randomized clinical comparative study is conducted to do the research of efficacy. And this is a classical microfracture-based repair tissue arthroscopic views. On the right says GMSC. This is allogenic TEC product name. So this is a picture of GMSC. As you can see in a microstructure on the left, you see uneven surface, and the borderline with the repaired tissue is clear. So it's unstable cure is observed in microstructure, but in the GMSC, you see more smoother, better repair on the right. If you make a statistical analysis with a significance difference, GMSC1 implanted group showed a good results in repair. So this is a cartilage assessment. And now on the deeper side of cartilage, there is subchondral bone. If you look at that, there is a microfracture. In this treatment, you have you do puncture in the bone or have a hole, and as a result, the bone gets harder, or the defect still remains. So some regions remain in microfracture, while in GMSE case, so in the damaged cartilage area, you implant this material. So bone part is very clean. So based on the statistical analysis, GMSC groups showed significantly better repair. So in the cell therapy so far, as for microfracture, this was developed 60 years ago as a treatment. So far, there has not been report that surpassed that microstructure, and for the first time, a GMSC treatment provides higher quality treatment against a microfracture. So we believe this could be a breakthrough. And TEC, this time I'm talking about cartilage, but there is a cushioning joint like the meniscus or intervertebral discs. This is a cushion in the vertebral or the growth cartilage. In this treatment, you are able to use this TEC. That's what we found out in animal studies. So in various application, this TEC can be used. With that in mind, we are doing our research. What I have introduced this time, this is a summary. So OA is an aging-related disorder, and that affects a large population worldwide. And this is a worldwide problem. And the initiation of this occurs by cartilage damage, meaning that if you treat cartilage securely, then you can stop the progression of osteoarthritis. So it is very important. And the mesenchymal stem cells, MSCs, there are not the conventional stem cells, but they are the medical signaling cells. So after you provide for a certain period of time, they will be gone. So immune rejection does not have to be taken into consideration. So you are able to use MSC for allogenic cells. And based on the efficacy and the safety, MSC can be used not only for cartilage, but also for wide-ranging motor-related diseases. Most probably, that's what we've hopeful for the future. In Japan, there are various research underway. In Japan and in the U.S., preparations are made. So in the world, I hope that many treatments will be developed so that those new treatment can be delivered to patients as early as possible. These are the collaborators of our research. I would like to express my sincere gratitude to them. Thank you very much.
Professor Nakamura, thank you very much for your speech.